moving down from the humerus, we have the ulna and the radius. Okay, unlike your knee, there's no extra bone. The elbow is just located right on the ulna. So as we slide down here, we have the ulna and the radius. Remember, ulna has the elbow in it, and it's going to be on your pinky side. Okay, so this would be a right arm. If you look, it'd be laying like this. Okay, or this is my ulna, this is my radius. That's how I have it laid out here. Things to know on the ulna, we have the Olecranon process. All right, the Olecranon process. That is this whole elbow here. All right, this whole elbow. It's a process. It's got rough bone, so you can tell that that's where things have hooked onto it. The Olecranon process. You have the trochlear notch. On your humerus, we have the trochlea. There's the trochlea. So it should make sense that on the ulna, we have the trochlear notch. Okay, it's a smooth joint. It's going to make the inside of our elbow there. It's giving it that nice U shape as the trochlear notch. Then the last bit of the elbow, if I lay it back down here, is we have the styloid process. It's not our first styloid process, but here is the styloid process hanging off right here. Once again, just like our ankle, this is going to form a little saddle joint that the hand is going to fit inside. Okay, so if you look at our wrist joint here comes the hand, here's my thumb, and the string's in the way here, but it would sit right inside there. Okay, that's that styloid process. Radius is here. One thing to note about the radius, once again, we're looking at it from this angle. Your radius rotates around your ulna. Okay, so as we're gonna call this pronating and supinating your wrist. That radius is rotating around your ulna. So the radius rotates. And you have a couple of things to point out. We have at the top here a radial tuberosity. Let me see if I can get a good angle that you can see. Tough to get a good angle on this one. It's right here. You can kind of see there's a little bit of a bump there. It's a lot easier to feel than it is to see. But radial tuberosity. And then at the bottom, we have another styloid process. Okay, this would be the radial styloid process, making up that wrist joint. Okay, so there is the bones of the lower right arm. Remember, in our wrist, we have all kinds of different little bones that we're not going to learn the name of.